Hello, and thank you for joining us today for this webinar on Engaging Young Children, Lessons from Research about Quality in Early Childhood and Care. Andreas Schleicher, Director for the Directorate of Education and Skills at the OECD, is joining us to present findings from OECD's most recent publication on the link between children's development and the structure of the learning environment, as well as the quality of staff-children interactions and activities. John McLaughlin, New Brunswick's Deputy Minister for Education and Early Childhood Development, will also be joining us to speak about New Brunswick's efforts in developing high-quality early learning programs. We will have time for a question and answer session at the end of the presentation, so please feel free to send your questions to e@oecd.org. Now, on to you, Andreas.
Thanks so much. I'm really pleased to share this study with you, which is also an important step for the OECD. We have always looked at structures in early childhood education, and with this report, we are moving a step closer to what's actually happening by looking at the interactions between process quality and outcomes in early childhood education and care. Let me first sort of highlight a few things that you may already know, namely the importance of brain sensitivity in the early years. We have traditionally framed early childhood education care often very much around the care mission, taking care of children when the parents work, but we now know that the early years are also very important phases where children develop important qualities like, social skills, emotional control, but also early language, early numbers. So actually the opportunities that we have in the early years for child development are very significant, well beyond the care agenda. We also know that the impact is particularly large for children from lower social backgrounds. We have expressed this on this chart through the rate of return. That's basically an estimate of what you will get later in life from investments that are being made early in life, and you can see the rate of return, particularly for children from low social backgrounds, is very high in pre-primary education. Then it diminishes as children grow older, and actually is in adult education and higher education actually lower than for children from higher, more privileged social backgrounds. So again, highlights the importance of investing early, particularly for children from disadvantaged backgrounds. Here on this chart, you see some of the kind of medium-term and longer-term benefits when you think about, early childhood education and care and school experiences. It's about working with numbers. It's about mental flexibility, working memory, and later on in childhood, we see benefits in terms of stronger self-regulation, also greater numeracy skills, and they play out later in the lives of people in many important dimensions. When we think about community context, looking at factors like trust, empathy, social behavior early in childhood, we can see in childhood later, between the ages of 5, 6 up to 15, strong social and emotional competency, and all of these things again, later in life they are reflected in a higher sense of general well-being, more life satisfaction, better physical and mental health, also better educational achievement, and then also employment outcomes. So some of the the things that we do with children early in their lives may not be immediately translating into social outcomes, but in the long run, there's strong evidence that actually those investments are very significant for the future of children. Now, what we've also seen is that a lot happened. If I would have shown you the chart here 10 years ago, you'd see that many 3-year-olds were still not in early childhood education and care. Whereas you can see here, if you look at the green dot, for example, enrollment rates at age 3, they're sort of roughly 2/3, 70% of children across countries. In some countries, it's basically 100%. In others, those rates, if you look at at the lower end, Turkey still only sort of 1 in 10 children, but more or less early childhood education and care from age 3 onwards is becoming universal in the majority of OECD countries. And when we look at the enrollment rates at age 5, that's the dark blue triangle, you can see basically in virtually all countries they are now universal. Virtually all 5-year-olds in most OECD countries are now in early childhood education and care. There's some surprising sort of outliers here. For example, Finland, one of the countries that we know is doing very well in schooling, has only an enrollment rate of 80%. Many children still stay at home, but those are exceptions. Basically, a lot has happened in the quantitative expansion of early childhood education and care. But that has made our report even more relevant. What is actually happening with those children? How are the structures, the places that we provide translating into better process quality? We also know that 15-year-old students, those who we measured, we basically looked at in our PISA comparisons, who were actually attending early childhood education and care for less than 1 year, were 3 times more likely to perform below even the most basic level of proficiency in science, mathematics, and reading. You can see that here on this chart. So basically, not having participated in early childhood education and care is a very strong predictor for underperformance later in life. Now, to some extent, these results are sort of entangled with social background. Often those most marginal children are not in early childhood education and care, and they then become subsequent lower performance. But you can look at this in a little bit more nuanced way by actually studying the enrollment gap between children from disadvantaged backgrounds and children from more advantaged backgrounds. And basically, this is one of the most sort of disturbing findings, that in fact, children who need early childhood education and care most, the disadvantaged, are consistently showing lower enrollment rates than children from more privileged backgrounds. So this clearly shows that, as much as we have done well in getting more children into early childhood education and care, the most marginal children are still often left out of the equation. It's more to do, and this is something that many countries still have to work on. Some countries on the left side, there you can say basically it's children from all social backgrounds that have access, but as I say, in the majority of countries, the children who need that development most are often not benefiting from this. And also it's for society not a very smart thing to do, because you've seen before that the rate of return is particularly high for the most disadvantaged children. So society as a whole would actually benefit most from closing that gap that you can see here. But, enrollment has increased, but the important issues that all countries face is, what kind of spending choices do we want to make? Some say it should be very sort of generous children-staff ratios. Yes, if you do that, you cannot also pay your teachers well, or you cannot provide them with lots of professional development. In reality, countries have to make really tough spending decisions. If you make sort of early childhood education and care free, how many hours are you going to make free? And what is the structure of those hours? How many people do we employ? What are the kind of career incentives, the professional incentives, and things like this? So it's very important to look at those kinds of choices, and that's something that we have done in this report. We basically distinguish between structural quality and process quality. When you think about structural quality, you think about things like the physical environment in which children are, the human resources that we deploy, also the material resources that are involved, things like child-staff ratios, kind of staff qualifications. They all come under the umbrella of structural quality. And of course, structural quality matters. But what matters even more, and this is something that we discovered in the course of working on this report, is the process quality. What actually happens in the settings, what it relates to the social, emotional, physical, and instructional aspects of the kind of interactions that happens in the playground, in the classroom, and so on. So these interactions, the process quality, is something that we have paid more attention to, because those kind of more proximal indicators are ultimately the ones that matters. And obviously, there's still the center of it, the learning and well-being of children. That's something that we have still left for the future to study more closely. So let's highlight some of the things that policy can get involved in. There are many dimensions of this. It comes, to engaging families and communities. That's obviously crucially important. It comes to curriculum and pedagogy. What is it that we actually provide for children, and in what ways do we provide this? It comes to standards and governance. Actually, how do we know how good is good enough? What are the systems of governance, of regulation that are involved to ensure that there is consistent quality? How do we translate standards into workforce development? Now, what are the staff qualifications, the continued professional development, the kind of support systems, the working conditions, all those things? And then finally, how do we know that these kind of things are happening? This relates to data and monitoring. So we had already, in the meta-analysis in 2017, looked at standards and governance, workforce development, and also data and monitoring. We now, in the policy review, Quality Beyond Regulations, that's the 4th edition of Starting Strong, included also the aspects of curriculum and pedagogy, and also what we can do to strengthen the ties between families, communities, and early childhood education and care. So those are the policy levers that we have studied, and I'm going to show you a couple of examples. And then, of course, you're going to hear from Canada about how to make those things work in practice. Now, what do we know in terms of evidence? When it comes to workforce development and also the working conditions, we have quite clear evidence that higher pre-service qualifications of staff working in early childhood education and care have a positive impact on the quality of staff-child interactions. Now, that's not surprising. If you have staff who are better trained, they will know how to better interact with the children. It's not so clear how this plays out in terms of child development. And when I say evidence unclear, it's simply that we do not have good enough evidence to either support or not support that kind of hypothesis. Whether the staff participated in service training, professional development also has a clearly shown positive impact on the quality of staff-child interactions and also on child development. So basically providing an environment in which staff can grow professionally is very important, both for the development of children and also for the quality of interactions. Now, how long staff have worked isn't so clearly linked, neither to staff interactions, and we don't simply know on child development. There's no data available on this. But overall, you can say workforce development and working conditions are an important predictor of process quality that we study in this report. When it comes to standards, governance, and financing, we can see that lower children to staff ratios are positively linked to the quality of staff-child interactions, but it's not so clear to what extent that holds when it comes to child development. And it's obviously always a difficult decision. Do I put the premium on, workforce development, staff qualifications, hiring more expensive staff, or do I put the premium on hiring more staff? And obviously that balance is a difficult policy choice, and what you can see is actually both staff quality and the children to staff ratio matter in terms of staff-child interactions, which doesn't make the choice really easy. Smaller group size, that isn't so clear. There are studies showing that it matters, there are studies showing it doesn't matter, and we don't know how it plays out in terms of child development. And then data on monitoring, basically accountability, reporting systems. Some studies show that they relate positively to staff-child interactions. For others, that link was not evident. And also on child development, we don't have clear linkages here. But as you can see, process quality as a concept is actually an important determinant, or at least predictor, of the quality of staff-child interactions. Now, let's look at some of those interactions in a little bit more detail. I highlighted a few points of evidence. This is something that I found really important. You can see how staff interactions with children are consistently associated with emerging literacy and also numeracy skills. And basically, these are very different settings from the United States, from Germany, from Portugal, and yet in almost all of the studies, you can see a quite significant correlation when you think about, effect sizes here, they're quite important. Basically, staff interactions and emerging literacy, numeracy skills are quite important positive link. Only in a couple of studies was that link not visible, which shows again, process quality really mattered. When it comes to workforce development and working conditions, we can see how professional development can improve staff-child interactions, but also child literacy skills. The staff qualifications, what kind of qualifications do staff have that can help prepare staff to become emotionally, educationally, and developmentally supportive for children. Qualifications is about competence, and competence is very important for the quality of interactions. We can also see that staff qualifications matter more for settings for children aged 0 to 2. Understanding how those children learn and develop is very important there. And it's also important to include specific content that is actually relating to early childhood education, child development, teamwork, and also team leadership. When it comes to staff well-being, salaries, organization, and climate, the evidence is still too limited to come up with strong conclusions. But as you can see, qualifications, professional development are really important dimensions here. So how do you get people to engage in professional development? It's one thing to provide opportunities, it's quite another to ensure that those opportunities are consistently used by staff. And as you can see here from a number of countries where we have data, financial support for training costs is very important. I'm making sure that these courses are actually accessible. That doesn't mean that people necessarily go, they're more needed, but that's sort of the necessary conditions. In some cases, you also have financial support to cover partial salaries. Very important, in most systems, they provide a path to higher qualifications. So actually taking part in professional development is always a stepping stone or building up, higher qualifications. Some countries support that also with study leave or higher salaries, promotion, and so on. So actually what you can see here is that there's a lot being done to see that staff do have those opportunities and use them, and that it actually is somehow accounted for in the qualifications. Coming to the governance and standards, those are obviously, it's easy to use regulatory factors. And what we can see is when it comes to governance and standards, that lower staff-child ratios can promote positive child relations. And that holds across all age groups. You've seen some of the data that I presented earlier. Group size seems to matter more for staff interactions with the youngest children. No, that's important. This is not a one-size-for-all kind of a rule. You can see that having smaller group sizes is more important for the youngest children. Later on, you may want to put more of a premium on staff qualifications. This is also interesting, where do you locate early childhood education and care centers? Are they separate? Are they integrated with schooling? And what we see is when they are integrated in schools, that can influence staff's educational activities. Not surprisingly, you're part of a larger educational setting with more training facilities. And we also see that classrooms with a more balanced or mixed group composition can ensure both equity and quality in early childhood education and care. Again, we had limited evidence for funding and intensity of daily service. That's sort of not so clear. But overall, you can see is that making sure that those kind of structural factors are present is quite important. This is just an image showing you the students, the child-staff ratios. You can see there are 14 children for every staff on average across OECD countries, but you can also see this varies quite significantly across countries. If you think about pre-primary education in Mexico, that's ratio is 25. In Australia, it's less than 5. So there's a lot of variability in basically ratios between staff and children across countries. And you can see also here, generally, when it comes to the very youngest children, those ratios get smaller. And as you could see also previously, that is sort of the kind of smaller group sizes are particularly important for that age group. It's also not surprising, taking care of smaller children obviously is a more staff-intensive undertaking, and as you can see, that's reflected in the way things are being dealt with. Now, last point really is data and monitoring. Now, we can only improve what we can somehow see, and actually, this is now quite well established in most countries, the kind of tradition they have in building a kind of more consistent early childhood education and care monitoring systems. A couple of lessons that we have learned is that when it comes to quality monitoring and rating improvement systems, now that's basically accounting for the quality of the environment, they were consistently associated with higher quality staff-child interactions, particularly in centers. We didn't have sort of consistent evidence for linkages between those monitoring systems and staff-child interactions in family daycare settings. That's obviously much more difficult also to to establish there. We found positive feedback loops between monitoring systems and staff practices that can be associated with gains in children's language development. And it's always important to ensure that information on staff-child interactions in centers is actually used to inform quality improvements. Now, collecting data is important, but actually what you do with this data is really what matters. When it comes to monitoring evaluation, there's always a balance between, using information for accountability and compliance, seeing that actually standards are adhered to, and feeding that information back to staff, to the centers, to encourage improvements in the learning environment. And there are different kinds of sort of processes that are being used. Accountability systems typically come from the outside. They are not done so frequently, and they are often risk-based. Now you go into the settings that are most at risk to give them more stringent kind of supervision. When it comes to the improvement functions, that's more frequent and more internal. And the devices that are being used for this range from inspections, parent surveys, peer reviews, more on the accountability side, and self-evaluations, monitoring children's own views, observations, more on the internal formative side. So very different kinds of systems that are being used and put in place. Now, that's what we know. That's what you can read in the report. There's still lots of work to be done to give us a better understanding of this. And let me show you just what we really need. We need more fine-grained evidence on curriculum and monitoring. We also need to understand system-level effects of structural features and process quality better. We need to have a broader understanding of process quality and further studies of quality for the youngest. And ultimately, also child development needs to be examined more broadly, taking a more holistic view on the cognitive, social, and emotional outcomes that are really important. Let me just highlight what we do on this. Our policy review, Quality Beyond Regulations, deals with all of the first set of factors. The TALIS Starting Strong survey, the very first survey of staff, giving staff serving in early childhood education and care their own voice, is actually going to help us understand system level effects of structural features, help us better understand also, the processes and also the potential incentives and barriers for taking part in professional development from the perspective of the staff. We're going to see that by the end of next year. And then our International Early Learning and Child Wellbeing Study is going to look and directly observing the kind of child outcomes that are important. Also with the pilot study coming out next year. So soon we're going to be able to fill the remaining gaps, or at least some of the remaining gaps in our evidence space. That's all for me, and I look forward to hearing about the experience in Canada.
Andreas, John, would you like to share findings from Canada, New Brunswick's school system?
Sure, thank you. Can you hear me?
Yes, we can hear you well, John.
Okay, and our presentation, I'm trying to get that up here. Nicole is working on that. Maybe I'll just make a few introductory comments. I do have with me here Nicole Gervais, who's our Executive Director of Early Childhood Development for the province of New Brunswick, and she really is the expert in all of the things that we've been working on and has been leading all of this over the last number of years. And I'm John McLaughlin. I'm the Deputy Minister for the Department of Education and Early Childhood Development in New Brunswick. And just to set the context a little bit, I can't speak to what Canada is doing in terms of early childhood development and learning, because Canada doesn't have one national early childhood department, just as we don't have one in education either. We have 13 provinces and territories, and each one does very similar things, but kind of oversees its own work. But the research that Andreas was just sharing, look, it's quite comforting to me to see all of this research and to review this, because it's very consistent with the work that we've been doing over the last number of years, and particularly in the last number of months. The things, Andreas, that you spoke about, and I'll make reference to them as I go through the presentation, certainly align with the goals, the things that we're really trying to achieve here in New Brunswick. So this research is very timely and will help to guide our efforts moving forward. I mentioned that we don't have one national early childhood department or plan, but we do have a federal government that is very, very committed to improving early childhood learning. And so government has committed $500 million over 3 years federally to support the provinces in delivering really high quality early learning. And for my province, which is New Brunswick, and we're on the East Coast, we're a fairly small province, but we're quite proud of the work that we've been doing. We've entered into a bilateral agreement with the federal government so that between our province and the federal government, we'll be investing $71 million over the next 3 years to really transform New Brunswick's early learning processes and programs. Andreas spoke about accessibility and about children who are disadvantaged being underrepresented in early learning centers, and that's certainly something that we've experienced here in New Brunswick, but it's at the heart of the efforts that we're trying to make moving forward. Everything we're doing is about improving accessibility for parents and children and affordability for them, particularly for the most vulnerable, and sustainable early learning centers. Because in New Brunswick, what we have is primarily a market-driven system, and we are moving towards a publicly managed and privately delivered system. And so, the daycares, as they've been called, are either for-profit or not-for-profit, but either way, they're all run privately, and many of them are private businesses. And so one of the challenges that we faced over the years is that you have private businesses and you have government inserting itself in terms of the regulatory framework and trying to improve quality, whereas the daycares have been trying to survive and trying to make a living. So that's been the context that we began with, and we've done some, I think, pretty exciting things, which I'll be happy to speak to you about. So moving beyond the regulatory framework, to us, the regulations are extremely important because they speak about really things that have to do with health and safety, things like background checks for staff and staff ratios to make sure that children are being well cared for, licensing and inspection. All of those things are really, really important, and they remain important. But we're moving beyond that to try to transform the early learning sector so that it really is building on strong educational child development practices and beliefs. And Andreas spoke about the return on investment, and the Conference Board of Canada, certainly the work that they've done would echo that. What they've indicated that for every $1 invested in early learning, the return is between $1.50 and $1.60. And I think the higher the quality of the early learning experience that you can have, the greater the return on the investment will be. So both the federal and provincial governments have been very, very interested in making sure that we try to level the playing field, try to provide the best quality early learning experiences for children so they can experience the kinds of success in life that that Andreas spoke about, physical and mental well-being and mental health, employment outcomes, happiness in life, contributions to society, and so forth. We're really focusing mostly on the families that are most in need in this transformation that we're doing. So we're offering, we always had parent subsidies to help with the cost of childcare, but Andreas spoke about the most vulnerable and most disadvantaged children a lot of them don't tend to be in early learning centers. And so what we're trying to do is get at what are the factors that are keeping them from that. Is it about just not knowing that subsidies are available? And in New Brunswick, actually, we're going to be going to free daycare, early childhood for parents who earn, families that earn less than $37,000 a year. And no family in New Brunswick will spend more than 20% of their gross family income, regardless of what they make, on childcare. So how do we get that message out, and how do we make the process for applying for that as easy as it can be and as less intrusive in families, and really getting to the parents to better understand the benefits of having their children in early learning centers. So I think we'll go to the next slide, Nicole. We're frozen. I'll keep talking. We've really been shifting in perception in New Brunswick from daycares being babysitting services for those who couldn't afford in-home services. And certainly when my children were young, we had somebody come into our house, and that was seen as kind of the best thing you could do for your kids, is allow them to stay at home and have a person come in and look after your children. And we've moved now through a lot of research that's taken place and a lot of effort by the early learning team here in New Brunswick to early learning centers, early learning care, child development, education, that this is really important experiences for all children. And there's growing understanding of that among families in New Brunswick. And so there's really a great demand for quality early learning centers. So what we're doing is establishing a high quality learning environment, both in the physical environment and, as Andreas spoke about, the human interactions within the facility, educator to child, educator to educator, educator to parent, that those relationships, we can't underestimate the importance of that. Continuing to build on the knowledge of the structural qualities such as ratio and group size and pre-service staff qualifications and so forth. But again, really focusing on the professionalism of the team that's working with children and the relationships that they have, because we know the relationships are really what can provide the really high quality experiences in early learning, in K-12 education, in post-secondary, and life in general. Relationships are really important. So we are proud that we were one of the first jurisdictions in Canada to introduce mandatory early learning and childcare curriculum frameworks. That was done in 2009. And New Brunswick, we are a province that has two official languages, English and French, and so we have those curriculum done in those two languages. And they're really grounded in evidence-based research and best practices, and that support moving beyond regulations. So we've been moving to align our governance to try to connect it to the school system. Our goal is to have a seamless transition of early learning from birth through early childhood, through K-12 education, into post-secondary and beyond. And so in 2010, began moving the early learning and childcare sector from being seen as babysitting to an educational services, when the early childhood services were transferred to what became the Education and Early Childhood Development Department. It had been housed in a social development department at the time, but there was a move, and this is what's happening pretty much across Canada, to bring the two together, education and early childhood development. We, in 2013, started to move towards trying to get the programs that are offered in early learning consistent with the regional jurisdictions of the school districts. There's 7 school districts in New Brunswick. And so early childhood services now, although they're still the responsibility of us centrally at the department, we share that responsibility with the school districts, and they're delivered within the same territory as each school district, and it's trying to create synergies at that level. In 2016, we released our 10-year education plans, two of them, an English one and a French one for New Brunswick. And this is what's significant there, is that this is the first time that early childhood was represented in the education plan. The education plans in the past have all focused on kindergarten to grade 12. And our education plan now is from birth right through high school. Our plan is to really separate the functions of early learning and early childhood, to keep centrally at our department, so we would have responsibility for the whole province on things like licensing and inspections and certification, those kinds of technical things, the regulatory things, but to move responsibility for early learning and support and pedagogical practices to the district level, and to move the staff that are responsible for that so that they would all operate under the governance of what we call district education councils, which are similar to school boards, under the authority of the school superintendent, who would have responsibility for the pedagogy, for the teacher training, for all of the things directly responsible for early learning would be at the school district level, whereas we would keep the things that would be more tricky for them to try to do at the same time, such as licensing or inspections or taking away a certification of a center and so forth. So the New Brunswick Early Learning Center designation is brand new, and actually March 1st, I think, Nicole, was the first ones. Through the funding that we received from the federal and provincial governments, the cornerstone is to establish early learning centers and to really move away from a daycare model, which was seen more as looking after children, to one that really has robust and strong early learning practices. And so those daycares that want to become early learning centers are able to apply to become one, and there are tremendous benefits in them applying. So what we're doing is, rather than forcing certain changes on the sector, we're kind of romancing them to say, if you want to be an early learning center and to improve your practices and to ensure that your children are receiving quality, inclusive, really great early learning experiences for children, evidence-based, if you're prepared to do that, then there are some things that we'll be putting in place. So there will be operational grants for the daycares to allow them to improve their practices, to improve their training and so forth. There will be increased subsidies for parents, including, as I said, free daycare for parents, families making $37,000 or less. There will be subsidies for the daycares to support them in creating infant spaces, because having infants, it costs a lot more. We know that it costs a lot more to operate infant spaces than it does after school spaces, because the ratios for educators and children are greater. So a number of things that daycares have to agree to become an early learning center. And the response has been overwhelming. Over 80% of we've divided up the province, and we're doing this in phases to make sure we get it right. So there's 2 cities in New Brunswick, one fairly large and one a smaller area, which are phase 1. And over 80% of the daycares in those centers have signed up for this, are very positive about it. There has been, for a sector that's very fragile, and in the past there have been times that have been quite combative as we've tried to insert government into the operations of daycares. It has been tremendously supportive of this. We were hopeful that most would want to be in, and what we're finding is we probably will have all daycares within a few years will want to be part of these early learning centers. I know I'm rambling, so I'll try to get back to my notes here. So there was operational funding, including funding for infant spaces. The market fee threshold, what that does is it recognizes that there are different costs associated and different levels of fees that certain areas of the province can handle more than others. And so urban areas versus rural areas and so forth. So we've established, if you're going to become an early learning center and receive the benefits of that, then you'll have to operate within a market threshold for your fees, and you won't be able to increase your fees beyond a small amount each year without permission because maybe something extraordinary is happening. And they're very good about that. Parents' engagement is going to be a critical part of this. For the first time, each of these centers will have to have a parent committee. Now, that's not a committee that makes decisions to run the early learning center, but it does provide input to the operator. An opportunity for parents to provide input, to give their thoughts on how things are running, to just give feedback on what the needs are of parents. So each of them will have an advisory board. We're establishing a child care registry, which is a provincial thing, and it's going to allow parents to register for an early learning center, to go directly onto a waiting list if there is one, to know what the waiting list is all about. The inspection reports will all be online, so really quite a robust registry which we'll be using. I'll skip down a little bit here. We're also establishing what are called centers of excellence. Now, this is a work in progress. This is something that we're planning to do. We haven't really hammered out exactly what they'll look like. But basically, looking at different themes in early childhood and establishing one for each school district, a center of excellence that can demonstrate to others around the province what does it mean to be innovative and to be excellent in areas such as inclusive education, or in terms of training of staff, or in terms of parent involvement, in terms of curriculum development. But we know that one of the things we've learned over the last number of years is that we can't just impose our vision on the sector. That we have to not just engage, not just consult, but deeply engage them in what is it that is going to work, because really this is their livelihood, and they are extremely passionate, our early learning operators and staff. So we'll be engaging them in what these centers of excellence can look like and how they could be operating. One of the things that we did learn is about we still have work to do in New Brunswick, because we are a province that continues to lag behind in terms of wages for early learning staff. The provincial government has committed to provide increases in the subsidies for staff of early learning employees, and the goal is to bring us closer to the national average. And so that has been extremely well received. In fact, one of the things that the centers told us, the operators told us, is that with all of the great things that we were doing in terms of establishing and transforming the early learning environment and landscape, if we didn't do something about wages, then it was not going to be effective. And so we did go back to the drawing board and are making those increases, and they're pleased with that. And the other thing is that we do have the lowest pre-service requirements in the country, and so we're taking a look at that as well, because the professionalization of the sector is extremely important, and having high quality people working with our youngest children and many of our most vulnerable is important to us as well. So that is what it is that we are doing. We're quite proud of it, and I'd be happy to answer any questions that you may have or get any feedback.
Thank you very much, John. We have received several questions from our participants. The first question is directed at Andreas, but John, please feel free to jump in if you have any. Andreas, in your presentation, you show that staff-child interactions are central to process quality, but that a broader understanding is needed. What does this imply?
Yeah, I think, we know a lot about, the qualifications of staff, where they come from, who they are, and so on. But when it comes to the interactions of staff with children, we need to develop a much better and systematic understanding of how those interactions actually affect child development, and the social aspects, emotional aspects, the cognitive aspects. And so far, what we have learned is that it is really the process quality that is proximal to the children and that ultimately has an effect on their development. But we are really at the beginning of being able to measure process quality and also looking at the links between child development. I think when we have our TALIS survey next year, we're going to be in a much better position on this, because we are surveying staff themselves. We will be actually asking them about their own pedagogical beliefs, their own pedagogical practices, their understanding of child development. And then later on, when we also have measures of cognitive, social, emotional learning outcomes of children, we'll be able to connect those. And I think that's what we really need to understand, what kind of processes are most conducive to child development, and then ultimately also determine how do we allocate resources best. I found actually the presentation from John McLaughlin really very enlightening in this respect, and it actually illustrates the difficult spending choices that countries need to make, when it comes to, I think it's only when we understand process quality better that we'll be able to guide this by evidence.
Thank you, Andreas. That leads me to my next question for John. In the policy efforts you spoke about for moving beyond regulations, how do you prioritize spending, and does your plan involve increases in spending?
Yes, absolutely. It involves increases in spending. The funding that came from the federal government and the funding from our provincial government is $71 million of almost entirely new spending over 3 years. And so how did we prioritize that? Well, we looked again at our 3 important pillars: accessibility, affordability, and sustainability. So what were the things that we could put in place that would make early learning accessible to all New Brunswickers? And again, focusing on the most vulnerable. That is why we identified being able to provide free early learning and childcare to those most vulnerable parents who, as I say, earn less than $37,000 a year, as well as looking at where in our province do we need to establish, excuse me, early learning spaces the most. We have some areas that have a lot, and we have some areas that are not really well served. So we're looking now at how we can kind of incentivize the establishment of quality spaces in perhaps more rural areas. Affordability, again, is about making sure all New Brunswickers have access and that they can afford to send their children to early learning, which is going to, for many people, allow particularly mothers to get back into the workforce or to go back to school and study and improve their lives. And then sustainability is a third, and so that speaks to ensuring that our early learning centers are able to continue to operate with high quality programs. We know that they need support. That's how we prioritize, and it's all new money. However, there are millions of dollars that we've already been spending year over year on subsidies for daycares, for wage subsidies for the workers, but also parent subsidies as well.
If I may just add to this, I really find the example from New Brunswick an excellent illustration of how we can actually target spending and link resources with socioeconomic needs. In many countries, spending is still tied to parental employment, where parents in employment will get more generous child subsidies and so on. But that's actually not often reaching the children who are most in need. And I think the example that we just heard is actually a very good way of, making sure that limited resources are actually matched to the children who will need them most.
Thank you, Andreas and John. We have a question that goes back to the report that you just published on early childhood education and care. The report shows considerable evidence on links of process quality with emerging academic skills. What areas of child development are covered by your report?
Okay, basically in this case, we only looked at early literacy and numeracy skills. That was the only one where we could actually see those kinds of linkages between process quality. But as our study on early childhood education and care on early learning and child well-being comes into place, we will be able to extend it to a much broader range of social and emotional outcomes. I'm not sure whether that answers your question. Otherwise, I'll ask my colleagues in Paris to speak to that.
Thank you, Andreas. This next question is for John. What lessons have you learned in moving towards a publicly managed, privately delivered system through investments in both affordability and quality?
Yes, well, we've learned a lot, and we've learned a lot over the last number of years. One of the things, and I spoke about it earlier, is how fragile and delicate the sector has been, and how sometimes any changes that government has tried to make have really been received with a lot of resistance and actually becomes quite political. And it's been seen as very difficult to make changes that would improve quality. Excuse me. So what we've learned is that, as I said, we really need to listen to and fully engage the sector and to really address the needs that they speak about, and to make this a partnership, so that what are the things that we believe based on research and evidence need to happen, but then what does it take realistically for the sector to be able to deliver on that. And that was one of the things that we learned well, because we've had experience where things did not go well in the last number of years. And so really fully engaging with the sector has been, I think, the most important. One of the other things is that we really needed to build in mechanisms that would safeguard our investments. For example, in the past, anytime we would increase parent subsidies, we would see the daycares increase their rates. And so there really was no real benefit to parents who needed the increased subsidies. So that caused us to look at, okay, what are some safeguards we could put in place? So that's where the market threshold idea came in. And when we did that, no daycare had to lower their rates. They were all able to, in order to become an early learning center, they could maintain the rates they have, but they just can't increase them. And so that protects the additional subsidies that parents are getting. So a lot of things like that. I think, it speaks again to the relationships that we have. We've done an awful lot of work. We had a huge study that was done. We hired 2 consultants to look at the early learning sector and to make recommendations on it. There were 2 experts in the field on where we needed to go, and a lot of our work has been guided by that.
And if I may add, what I take away from the New Brunswick example is it's probably mattering less whether provision is publicly or privately managed. What really matters is the regulatory framework that is put in place and the kind of standards and to ensure process quality. And I think, again, the example that we had is a good illustration that this can be reconciled, a public system with private delivery.
Thank you, John and Andreas. I have a follow-up question on funding for John. What is the policy of New Brunswick regarding children and toddlers with special needs? Do they go to the same schools and do they attend the same classes as other children? And do these schools receive additional funding for these children with special needs?
So we have a fully inclusive education system for kindergarten to grade 12. Every child in our school system, and that's not speaking to early learning, but I will get to that just to show you where it is we're trying to head. Every child, regardless of their disability or their talents or medical condition, every child has a place in a provincial school, public school in New Brunswick. And that does it has its benefits, but it also creates some challenges. For example, we have students who would be severely autistic, who are in the regular classroom to the extent possible with other students in the classroom, and a lot of supports in place for them, and a lot of training that we do in that area, or in any area of any special needs or exceptionalities. We're moving towards that in early learning, but again, we don't operate the early learning centers. We don't operate the daycares. There is in order to become an early learning center, they will have to have an inclusion policy. However, we recognize that the cost of having a fully inclusive education system is staggering. the numbers of supports that we put in place in terms of education assistants, for example, or specialist teachers, or psychologists, or social workers, all of those things need to be in place, and we can't put that on the early learning sector at this point. However, we are trying to have them move towards being more inclusive, and to actually to have an inclusion plan that that will be part of their early learning center plan. Yeah, each of the early learning centers will have to have an inclusion policy as being part of part of the process. But really, I think we have a model that we've worked with for 30 years in the education system, and a belief in New Brunswick that all children have a right to be in school, to be with their peers, and that's kind of where we're trying to head with the early learning.
Thank you very much, John. I think that's it for questions today. Andreas or John, would you like to add any final words on the report or findings?
No, not from my side. Thanks, Rose.
No, thank you for the opportunity to share and for the great work from the report. As I say, it's quite heartening to see that we're heading in the right place, and there's some research behind it that perhaps we weren't aware of as we were building this over the last number of years. So thank you very much. And we're happy to share any of our experiences with if anybody wanted to reach out directly, we'd be happy to continue the discussion.
Okay, thank you very much to both of you, and thank you to our participants for your interest on the OECD's work on early childhood education and care. If you would like to find out more, we invite you to visit our website at www.oecd.org/education. Thank you again for joining us.